Hello Malaysia, and thank you very much for joining us right here on BNC Medical Today, Episode 3. I'm Jared Ratnam. Joining me in the studio is Dato Dr. Sharifah Fauziah Al-Habshi, the Executive Chairman of Global Doctors, and Dr. Navindra Nageswaran, Group Medical Director for Global Doctors, and they're here to expand on aging and well-being, more so oral health. That's what we're going to be talking about today. Thank you very much for taking time off your busy schedules to join us on the show. Now, just to get into it, we talked about this well-being and health. This happened last week, and it's very much closely linked to what do you call it? Aging and well-being. Now, in our first edition, we did talk about the body overall. Today, we're going to talk about the top half, which is this area of the body, and this is something we never think about all the time. Most of us go to work, come back, and there are lots of things to discuss with regards to this. So could you first describe the aspects of subjective well-being that can be distinguished?
Subjective well-being is very closely linked to age, and WHO is classified into 3 groups. One is evaluative well-being, which is you're satisfied with life and everything is sufficient. And then you have the hedonic well-being, where you have anger, frustration, depression, not happy to the fact that you're growing old. And the last is basically the eudaimonic well-being, which is where you have a purpose, you have a strive, and that's actually the best place to be in, because that keeps you driving forward. Instead of aiming, you've got to keep aiming longer to live and happy and healthy.
I think the best way to move forward in life, and a lot of people say this, and I spoke to Robin Sharma and he said, always smile and it'll move you forward in life. Dato, what's your take on this? Because, you know, oral health is very important. So keeping yourself smiling or being able to smile is very important. So where do we start with regards to this when we discuss oral health?
Yeah, I kind of disagree with you, Gerard, about smiling. When you smile, the whole world smiles with you. You know that, right? Yeah, because when you smile and you're confident enough to smile, it shows that you are a relaxed person, a confident person. Now, having the ability to be able to smile, to talk with confidence, requires that your oral environment is, shall we say, healthy. And we talk about being well. No one is actually well unless he's also orally well. So when you talk medical wellness, you must never forget that oral wellness is as important as medical wellness. So what do you mean by oral wellness? It means you're in a state of comfort, in a state of where in your mouth everything is healthy and you don't have any medical issues, or you don't have any issues that compromise your ability to speak, to eat well, to have good nutrition, and to be confident.
Right. So that also comes, there's a lot of different factors that need to be looked at. Halitosis is one of them, which we will delve into later. But when you speak to people, I don't know, a public perspective, let's take a look at it now. Just people you know, do they know enough about oral health?
In general, I think people realize it's important to have good oral health, or dental health, if you want to call it that as well. But it's a question of whether you pay attention to it or whether you give it a priority when you talk about health. And many a times we find someone who says, oh, I'm healthy. When you talk to them about health, oh, I'm healthy, I'm good, I don't have diabetes, I don't have blood pressure, I don't have everything. But when you're in the dental chair and you realize that, and you know for a fact that there is a lot of issues in the mouth which can affect their general health. Right. And this awareness of oral health is an important part of general health, is very much lacking in our population.
And this is where primary health care comes in. No, before we got in the airwaves, you kind of explain to me how important primary healthcare is with regards to oral health. And I never saw this before. Can you please, share that with us?
See, primary healthcare, your GP, you go visit them probably 2-3 times a year if you have a condition or you don't. But generally what happens is if you go with a sore throat, they look into the oral cavity, but they look but they don't see. They look straight into the pharyngitis, they look at the disease perspective. But the wellness, they don't tell the patient, we don't educate the patient, we don't tell them what needs to be done. And then we should actually refer them to our dental colleagues to say follow up, because your dental caries do have an implication in your diseases that you are suffering from.
Right. So if you're going to your primary healthcare provider, say for a sore throat, and you now have this information that he needs to give you a full oral check just to make sure that everything's okay in there, and if there's anything not right with your teeth, you need to check with a dental specialist.
Yes.
How do you address this with your primary healthcare specialist or your primary healthcare giver?
I would say normally if you see it, in my own experience in the last 20 years, if I see something, I'll quickly refer it to the colleague. I said, as much as I've treated the tonsillitis, it might be a chronic recurrent. So I said, but your oral hygiene is poor. There looks like there is some kind of a dental carie, because we're taught medicine which will able to identify the basics and refer to a dental colleague to further manage.
Right.
I'll add in here. Medical practitioners always look in the mouth. As part of the general examination of an individual, it's always open your mouth, have a look at tonsil, and everything's fine.
Yes.
But they fail to see. They look but they don't see. There are other things in the mouth which relates to overall health. Again, I go back to the health of the oral cavity. If you have an obvious situation where the individual has got decay, has got bad breath, has got gum disease, it's something that a medical practitioner can easily pick up.
Yeah.
Yeah, and tell and alert the individual that, my friend, yeah, you have some issues here and there, but you also have an issue with the fact that you have a problem in your mouth.
Okay.
It's best to address it by going to your colleague, the dentist,
but
which can be just a general practitioner.
Now that we have this information, and for viewers who know this now, okay, I go to my doctor and my doctor looks into my mouth. He looks at all the problems. He knows I have a dental problem but doesn't address that with me.
Yes.
How do I address that with the doctor or the medical practitioner?
You can ask him.
Can you ask?
Yeah, you can ask him. You see, when you do a medical checkup, you do the blood pressure, vital signs, your weight, height and all that. But they all look into the throat. They do look tonsils, they look at the whole thing, but they don't, like I said, they look but they don't see. Dental is one position where they can add it into their screening and say this part of it needs to be referred. It cannot be handled by the general practitioner, but he can identify it, and because this is part of preventive medicine, you can easily refer it.
Yes, what we have to understand, Gerard, actually there are many things in the mouth that is a representation of your medical status, a medical condition. We'll come into that later on when we talk about diseases in the mouth. But it's wonderful if we can get that going, this integration about medical and dental, realizing that both of us have a role in the health of the individual.
Right.
Just like I look into a patient's mouth and I say, everything's great about you. Before we begin, I always, and we must always ask, do you have a medical history? Do you have diabetes? Do you have high blood pressure? Are you on any medication? Because all of that may have a bearing in your oral presentation.
Right.
And similarly, in the medical person who looks at the person and looks in the mouth, can always say, ma'am or sir, I think it's best that you address these issues that you have in your mouth, and send over. So there's a close link between oral and medical, and that is the right way to address a holistic approach to address a health of an individual.
Okay, I'm going to digress here, but Dato, you're quite a celebrity in Kuala Lumpur and also in Malaysia. You're an implantologist, you're an oral surgeon. Can you please explain to us your area of speciality? So, some of us don't know the difference between a dental clinic or a dental surgeon, an orthodontist. There are people who have different areas of specialization. So, what's your area of specialization? Everything, I suppose.
A general dentist is also called a dental surgeon. Then you begin, after your career in the basic dentistry, you decide in your life, do you want to go into children dentistry, which you call pediatric? If you want to go and do gum dentistry, it's called periodontic. If you want to be a surgeon, then you're oral surgeon. If you want to do braces and stuff, you're an orthodontist. If you want to do anything to do with public health and public care, you're a public health specialist. So there are many areas of specialty in dentistry.
Right.
I started out with dentists, I went to surgery and moved on into a higher level specialty of surgery called oral maxillofacial surgery. And also now I'm focusing more into implants, which is basically replacing a missing teeth with something artificial but functional.
Now, what we want to talk
Bionic
she's done everything. She's done everything. She's gone the whole 9 yards. So to speak,
exactly.
with
Not
regards to
entirely.
dentistry.
Still got
So
more
we
to
talk
go.
about aging and well-being and aging and oral health. So people say when people start getting older, they need to look after their oral health. I think there's a bit of a problem with that. You need to start looking after your oral health when you're young, and most of us don't. Of course, I'm talking about it now, but most of us don't. So, and you play a very important role, Dato. You play a very important role in educating people, because people see you from the time they're young till they become adults, they become comfortable with you, and they only trust you. Now, tell us about your role in educating your clients or people who see you.
Right, that's a very good question, Gerard, by the way. Actually, educating an individual or a person about oral health or dental health starts even before you're born. Your mom carrying you, you're still a fetus, a baby developing. At 2 months of age, or 2 months of age as a fetus, your teeth material is already being formed. At that point in time, the mom already must realize how important diet is and its effect on the developing tooth bud. As a child comes, the first set of teeth comes around 6 months of age. Oral care is really important. Realizing that it's important to clean the teeth in the mouth is important. And as you go and progress, teeth drop, new teeth comes out. At that point in time, again, care is so important as you go on up to your old age. Every aspect of your life, dental care is as important as when you're young or when you're very old. And there's no reason that you must lose a tooth or teeth in this day and age if a little bit of care is taken right from the beginning.
Right.
We like to have teeth from womb to tomb.
From womb to tomb. On that note, we'll take a short break. We'll come back just after this break and find out more about oral health right here on Medical Today. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Hello and welcome back to Medical Today. We're talking about aging and well-being. Today we're looking at oral health, something we rarely talk about, and we've got a subject matter expert in the studio with us. We have Dato Sharifah, and also joining us in the studio is Dr. Navindra Nageswaran to talk about aging and well-being. Dato Sharifah is going to weigh in on oral health. Now, with regards to what Dato Sharifah was saying, we'd like to talk to you now, Dr. Navin, get your take on just well-being and the other things that we need to look at, like, for instance, to integrate at the primary care level. How do we do that?
The primary care is like the front line of your health care. It's your gatekeeper. So the gatekeeper should look at the person holistically and don't miss the oral cavity. We look at diseases. We try to catch diseases like diabetes, hypertension, but there are lots of correlation between the oral cavity. So early prevention, early detection can be done. Don't you agree?
Yeah, but they say it about everything else. Okay, now people look at your eyes and say, you know, we can tell what's wrong with you by just looking at your eyes.
Exactly.
Absolutely.
Yeah.
Absolutely.
So when it comes to oral care, you know, looking at the oral cavity, what can you tell about diseases, Dato?
Okay, I would say the mouth is the mirror of your soul. Some people say that, you know.
Oh, that's interesting.
Yeah, well, many things happen in the mouth. All you think there's only 32 teeth and the gum and teeth and the tongue, that's about it. But actually, a lot of things happen in the mouth that reflects your medical status. For instance, if you're anemic, your nutrition is poor, for instance. When you look into a person's mouth, you find the tongue is pale, the lips are pale. That is a reflection of something is not quite right.
Not pale, no.
You know, you're looking good. Or someone who's got diabetes. Dr. Navindra, you've seen people with diabetes frequently, and you
gum
know.
health. Gum health is very important.
Right.
And in diabetes, you have uncontrolled diabetes. Some people control it well enough, but sometimes their sugars are very high, but their gum health will be very poor. And this is where you can identify them much earlier and then help them out.
I always tell my patients, you have diabetes, you're a very sweet person. A sweet person means you're prone to infections because you have an environment in your mouth that is very nourishing and wonderful for bacteria to multiply and to develop. So people with diabetes often tend to have a higher rate of gum disease, and in particular periodontal disease, which is shall we say, a much more aggressive form of gum disease. Yeah, in patients with uncontrolled diabetics, periodontal disease can worsen the whole situation of their diabetes. Yeah, and if you were to talk about periodontal disease and the progression of periodontal disease, why we're so worried about it as dentists, why we're worried about it, it's because you can end up losing your teeth for no reason. The teeth can be absolutely fine, the tooth is absolutely fine, but the supporting structures, because of the effect of the bacteria, can lead you to lose the tooth due to the separation of the gums from the tooth, due to the resorption of the bone, due to the widening of the periodontal ligament, and result is you lose your tooth for nothing, for no reason.
To add on to periodontal diseases, basically, blood pressure. It's ironic that sometimes we don't realize that people with periodontal diseases actually have higher blood pressure.
They do.
And you can actually catch it. So, and people with good blood pressure will actually have no periodontal diseases.
But at primary healthcare level, you check someone's pressure, can you tell that straight away?
No, you can't. You can't. You have
to refer.
No, you can't, because you can have a fantastic blood pressure situation, but your oral health may still be not the best.
Which brings me to my next question. You know, pH, oral pH.
Yes.
Can you expand a little bit more about this, or give us a bit of an insight on this?
Okay, the pH of the saliva of the mouth is usually around 6.5 to 6.7, 7.6, around that area. It's just slightly alkaline instead of acidic. And it's very important. It's a buffering kind of shall we say, nature naturally keeps our mouth buffered into an alkaline environment. Because if it were acidic, then we'll have much more damage in the oral cavity.
Right.
Because we know acids destroys.
So saying if one has GERD or gastroesophageal reflux disease, and you get acid coming into the mouth, it's going to.
They'll usually, those people who have GERD will only usually have sore throat, pain in the throat, because the acid actually burps out. Right. And that condition where your enamel and your dentin actually gets damaged because of the high pH the acid creates.
What happens, acidic saliva due to GERD, causes demineralization, which means basically the enamel of the minerals of the enamel is eroded little by little.
It eats through the enamel.
It eats through, putting simply, it eats through the enamel. And the end result is, of course, a cavity.
Okay,
or
at home level now, you know, this, if you go to a pharmacy, there's so many things being sold for dental health care. What works, what doesn't work?
Oh, well, trust
Did I put you in
No,
this
absolutely fine. You should ask the opinion of your dentist. There are many products on the shelf, yes. Some are really doing some good to you, some are just feel good, but nothing comes out of it. Most products which contain antiseptics or antibacterial agents are useful, but you have to know how and when to use them. You just don't use them injudiciously, because some products can stain your teeth.
Right.
Some product can alter your normal oral flora in the mouth. So you need to be guided, you need to be advised.
Right.
Don't say, just because I'm using this, it is great for me, you should use it too. It doesn't work that way.
I mean, just toothpaste itself, there's a smorgasbord being
Yes,
sold.
yes,
out
yes.
there,
So
you know,
many different types.
The
Absolutely.
herbal ones, the ones from Japan, the ones from America.
From
But we'll come back.
India, from
And I
everywhere,
want to
yeah.
ask you about toothbrushes, because
Yes.
there's this question that's always asked about toothbrushes.
Okay.
Let's come back to you. You know, how would you see primary healthcare, you know, helping more with regards to what Dato is doing?
I think we should take up primary care with executive screening to add in the oral health check to look carefully.
Something we could have thought about a long time ago. But yeah.
Yes, that's one. And the second part is, I think, most of the non-communicable diseases that people have usually come to the primary care, like hypertension, diabetes, your fatty liver, heart disease, osteopenia, osteoporosis, cancer, COPD, all that comes at the primary care level. So if you are the gatekeeper. So many of them are correlated to your oral cavity, as we discussed just now about dental caries. Halitosis is something you mentioned just now.
Right.
You know, we usually the first thing we look at acid reflux. We look at things down below, but sometimes it could be just dental caries if you look carefully before you go down and start treating halitosis differently.
Can I add to that?
You can add that.
Please.
Yeah, because I think two very important diseases which is often overlooked, two conditions, let's put it. One is heart disease in relation to periodontal disease. You know, a lot of people who have periodontitis, uncontrolled, I explained to you briefly what it was all about, tend to have a higher incidence of heart disease. Basically, the bacteria in the mouth is really having a fine time. There's a reservoir of bacteria in the mouth which you're swallowing. This bacteria enters into the bloodstream. It circulates and settles on the vessels of the heart, contributing to perhaps you're already having some atheroma, a blockage of the heart. It just contributes further to the blockages of the vessels, and people with uncontrolled periodontal disease have a higher rate of heart disease.
We've got about 30 seconds left on the show, and this is a question everyone's asking.
Yes.
Toothbrush, hard, medium, or soft?
Most times I recommend medium. Soft toothbrush is good in certain situations where you already have some problems in your mouth and you don't want to further traumatize yourself. Hard toothbrush oftentimes end up in you causing more damage to yourself, iatrogenic.
Right.
You produce a problem
I'm
to
doing
yourself.
it to myself.
Brushing too hard because I want to keep it clean. I want to make it white like that lady in the show or something like that. It doesn't happen.
Well, we've run out of time.
Scrub
Dato,
down.
it was a pleasure having you on the
Pleasure,
show.
yes.
Doctor, we hope to see you next week. We just spoke to Dato Sharifah Fauziah Al-Habshi, the Executive Chairman of Global Doctors, and Dr. Navindra Nageswaran, Group Medical Director for Global Doctors. We talked about aging and well-being. Our focus today was dental health or oral health. Stay with us right here on Medical Today. We'll take a short break and come back with segment 3.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye.
Hello and welcome back to Medical Today. This is segment 3 of Medical Today. Still with me, Jared Ratnam. And right now what we're going to do is walk you through a little bit of what's happening in the world of diabetes mellitus. Diabetes, let me just tell you, and most of us know this, that diabetes does not discriminate. And it keeps increasing over time. The incidence of diabetes in Malaysia and outside the country is growing. The numbers are growing as we speak. And it is largely because of lifestyle changes that are not being made at this point. Now, diabetes is the leading cause of blindness, they say, kidney failure, amputations, heart failure, and stroke. We did do a couple of interviews. A very interesting interview was done by Nurata Amin. She spoke to Dr. Lim Siang Chin, who's a consultant endocrinologist and a physician from Mahkota Medical Center, Malacca, and also Dr. Shiong, a consultant nephrologist and physician from Mahkota Medical Center. And we also, in this interview, had a dietitian on board. Puan Salasiah binti Muhammad Puji was a dietitian that was involved in this very interesting discussion about diabetes. Let's take a look at it.
Diabetes, the mother of all health complications, is a silent killer in Malaysia. Malaysia has the highest rate of diabetes in Asia and one of the highest in the world, but yet 2.5 million adults here are unaware they have it. So why is diabetes a neglected health condition here in Malaysia? Dr. Lim, thank you for joining us today. What do you say?
Yes, you mentioned about diabetes is a silent killer. It is a very silent disease. So the first couple of years when the patients develop diabetes, they don't know they have diabetes. So half of our diabetes patients are not aware they are actually have high sugar.
But speaking about the mother of all health complications, what are the various diseases that diabetes is associated with, Dr. Lim?
A lot of people are not aware that diabetes per se causes a lot of problems in the vessels. So you know blood vessels run in our whole body. So smaller blood vessels, it affects our eyes, it affects our nerves. So we have a numbness over our feet. And then bigger vessels, it affects our heart, our kidneys, and also our brain. So you have anything to add?
Yeah, so as what Dr. Lim has mentioned, diabetes is a multi-system disease. It affects every part of the body from top to toe. Wherever the blood flows, that's where you will get some complications. Some severe and very mortality related, high morbidity related. And the difference is how well do you control them. Some patients will say, why is it that some patients have it and some patients don't? It's about the control. Yeah, so it's going to affect the whole body.
Okay, that's the scary part. The process that affects the whole body. So how long does it take usually?
It also varies according to patient, but it tends to happen a few years after you start to have diabetes. And as we already mentioned earlier, it's neglected in the precious first few years. Those are the years that patients don't feel unwell. And they feel, it's okay, I don't feel well, why should I take my medicines? And that's where complications start. And the challenge is when the complication has already occurred. And there's a lot of times the complications are not reversible.
Right. So, okay, before we delve deeper into this topic, right, could you share a little about pre-diabetes?
Yes.
I bet most of our audience would like to know, and what happens when someone is diagnosed with it?
Pre-diabetes is a stage before the diabetes. Why we classify them as pre-diabetes is because they stand the highest chance of not getting diabetes during that period. So how do we define? Basically, we say that if your fasting is more than 5.6 but less than 7.1, and after food or after a glucose challenge is between 7.8 to 11.1, we call it as pre-diabetes. And why is it important? Because we know that during this period is where we can prevent diabetes the best.
Nowadays, we tend to do more screening. We try to encourage more screening, and that's when we start to pick up patients who are not really diabetic, but they are not really normal. So we clump them and we classify them as pre-diabetes. And a lot of times we may not need to start patients on medicine at that stage, but that's where it is still possible to reverse them and prevent them from progressing into full-blown diabetes.
What are the types of diabetes and the common ones affecting us?
Yes, we have type 1 diabetes, and we have type 2 diabetes, and we have this called gestational diabetes. Type 1 diabetes, not very common, happen in younger children as well as adults, not common. Type 2 diabetes, vast majority of our Malaysians. Gestational diabetes happen during the pregnancy only. So if you ask, out of 10, maybe 8, we are having type 2 diabetes.
So the type 2 is one of the most common ones,
Yes.
affecting the adults
Yes.
and also the younger ones.
Nowadays, we are seeing younger and younger people develop type 2 diabetes.
Okay, is diabetes curable?
Well, for time being, we say that our diabetes can go into remission. We don't call it curable. There's a reason why. So a certain diabetes patients may not need medicines. They can control their diabetes just with lifestyles, diet and exercise. But it doesn't mean that the moment he let go his food control, then his diabetes will not come back. So we don't call it cure, but then we call it diabetes can go into remission.
Okay, so what can individuals do to reduce their risk of developing diabetes?
There are big studies showing that there are ways that we can do to prevent diabetes or to help diabetes control. Exercise, 150 minutes every week, diet, and then we usually emphasize a lot in terms of carbohydrate countings, a lot of fibers, and then reduce carbohydrate, reduce fine processed food, fine sugar.
Okay, and I know you're like the master of kidneys.
Yeah.
Dr. Yu.
Yes.
So what about kidney diseases? Why is diabetes a major risk factor for this, and what precautions should one take?
Yeah, as you mentioned, kidney disease is a very gaining a lot of prevalence lately. And in Malaysia per se, in 2018, we already have 40,000 patients on dialysis. And for all these patients on dialysis from kidney diseases, more than 2/3 of them are caused by diabetes.
Okay, is it an increased rate compared to
Yes.
2017?
Yes. In fact, we are getting more and more patients on dialysis, and more patients are diagnosed with chronic kidney diseases, and majority are due to diabetes. And the rate is going up. So far, there's no sign of slowing down. It's like a runaway train. And back to your question about saying, what can we do for patients on diabetes? How do we prevent them, or how do we, cure them? Well, I probably mentioned earlier, or we tend to say prevention is better than cure. So if there's a way to prevent kidney diseases in diabetes, it's about how good do you control them, especially in the early phase. So diabetes, you have higher sugar than other people's. As long as you bring it down to normal and you keep them normal, you will not get the complications. You will not even get the kidney diseases in the first place. But sometimes, some patients are at higher risk, or some patients, because they really may have lapsed in their treatment in the early phases and they do develop kidney diseases, then my advice is still try your best. We always help you. We always help the patients to bring it down to as near as possible and make sure that the root cause, and in this case diabetes, is controlled well, together with the other diseases that may come, such as hypertension. We should be able to bring the diseases under control, and we should still aim to prevent patients on kidney problems until the stage of dialysis.
Right. So the rate is alarming.
Correct.
And is also a warning for all of us Malaysians. So what are the warning signs should a patient with the risk of diabetes look for?
For the patients, we actually suggest screening, because by the time they have signs such as they see bubbles in their urine, or when they have pain, sometimes it's already a late sign.
Pain
So, pain in the leg, because that time the nerve is already damaged. Or when they see bubbles in the urine, that means that they have passing a lot of protein in the urine. Usually this is already late stage. So we prefer the patients when they are well, then they do a yearly screening. what to screen? We screen their eyes, we screen their urine, we check their legs, we check their feet, we check their nerves. So we do preventions before they have the warning signs. We hope patients don't come to us with warning signs because it is a late sign.
So I think I would like to add to that. So you were mentioning about warning signs and how do we pick them up. Sometimes it can be nagging small complaints which the patient may not be aware is important. They might feel a bit of tingling in their fingers, but for all we know, it's already the nerve being damaged. So that's just an example. Or maybe the vision, they may feel it's a bit of blurring of vision, but they didn't have the eyes checked, and it could be diabetes itself. I guess one important way of trying to pick them up early before worsening of the conditions come in, A, we try to educate, and B, we should have a very thorough, systematic approach, whereby a patient don't see the doctor just because of the sugar levels and just look at the numbers. We should be looking into all the body, in the whole process, the whole organs that will be affected. And that, I guess, is something that we strive to improve on.
All right. So the experts in the US, they say that sugar is like an alcohol for a child, for a kid, or for a baby. So what is a healthy glucose level, since you mentioned it, yeah, Dr. Yu, and why is it important to maintain?
So as a sugar level for all diabetic patients, we know this is the ideal level. Okay. Sometimes we individualize a bit, especially when the patients become frail. Maybe they age, they become elderly, or they may have more organ failures like kidney failures or heart problems. Sometimes those are the patients that we may have to individualize the target. So some patients we tend to let loose a bit because we are worried of the hypoglycemia, meaning the sugar is too low. That can cause even more problems than a higher sugar. That usually is for certain patients where they are very fragile.
So how to get them back to normal level?
So we try to bring down to normal with multiple approaches. We still try, and we should always emphasize on the diet and the lifestyle, but by all means, we still need medicines. And medicines can include oral therapy and injectable therapies. So I guess in the end, I tend to let my patients have a bit of say. I tend to educate and tell them why you need these medicines and how does each medicine work, and I try to make them comply. A lot of times patients are worried that the medicines are going to harm them. That's why sometimes compliance are poor. So I always involve them in the discussion of the options of therapy, hoping that they will also understand and be confident in taking their medicines regularly.
Right, so what should healthcare providers do in order to create more awareness and help curb diabetes from further causing more concerns and risks of diabetes to Malaysians?
I feel we should try to approach this in multiple levels. First of all, as individuals, the daily practice, we try to educate the public at the practice, to the families, to the relatives, to the friends. At a higher level, we should try to organize more and more public talks or public awareness campaigns so that we can reach out to more people at one go. And of course, in order to improve the quality of service that we provide, we should have more platform where we can share our experience, share our knowledge. So just for example, just recent few years, our hospital, we actually have a health talk, and not only for the public, but for the local doctors, the regional general practitioners and the specialists that's involved in diabetes care. So I think it's supposed to be very multi-level so that we can be efficient with our resources and to approach and disseminate more knowledge to all the public.
All right, so it's interesting what Dr. Yu has shared. So Dr. Lim, should programs be inculcated at young age for children to learn the do's and don'ts to prevent diabetes or the disease from seeping into our lives?
Yes, I agree with you because prevention is always better than cure. Well, one of the way is even during the gestational clinic. That means that when the pregnant women come and follow up in the clinic, I think we can already teach about what is food, what is the good food, because we know that a mother who have higher risk of develop diabetes, their children will have much higher risk of getting diabetes. So during that time, I think teach a mother the proper way of preparing food will be very beneficial.
Yes.
When the children come to the school, Then also let the canteen also have a good portions of food. When we are talking about suku separuh as promoted by Ministry of Health, where suku is a carbohydrate, another suku is a protein, and the half portion is supposed to be a fibers. So we would like to implement healthy lifestyle from young. And also I'll say that NGOs has done a lot of things, even certain private companies in their canteen, when they provide food for their workers, I think they can always give water instead of teh tarik and more vegetables and less char kway teow.
So cafeterias, schools, are the best spots to actually start. And in terms of wound care, come to the serious part. Wound care, if the cases are so acute and the patient is unable to come to the hospital for a treat, what would you recommend?
Well, for wound care, a lot of times diabetes patients have wound and they may feel reluctant or difficult to come to a healthcare setting for treatment. And I think something that we can do, and which we are actively doing, is we provide nursing cares and doctors' cares that actually goes to the house of the patients. Some of the patients are not easy to mobilize around. So we try to provide this care that penetrates into the society. That is important because a good wound care can actually save limbs rather than having it worsening and then we end up with chopped legs.
For our dear friends, 2.5 million of Malaysians, that you are not aware that you have diabetes, just remember this is the golden period that you can get yourself well. Go to your general practitioners, have your glucose check, or like our hospital, we provide free finger prick checking every fortnightly. Just do it. If you have it, we can do something about that.
For example, if you detect them early, you change a bit on your lifestyle and your diet. This is like what our Ministry of Health is talking about. They're talking about suku separuh, meaning a quarter of your meal should be carbohydrate, another quarter could be your proteins, and then half of your plate should be more on fiber-based food such as vegetables. So you just try to do that.
Okay, that's nice. Thank God that I love veggies. So I like that. Suku separuh. So suku of meat, suku of carbo, and half is vegetables. Thank you, Dr. Lim. Thank you, Dr. Yu, for joining us today. So do your screening today. Now. I'm a tongue. I think I have to.
People with diabetes or at risk of diabetes should adopt healthy eating practice. They should control amount of carbohydrate intake and incorporate dietary fiber into daily diet. Food they should avoid is alcohol and any sugary food and beverages. Other than that, they also have to limit total fat intake and sodium intake. Limit total fat from saturated fat like red meat, processed meat, palm kernel oil, and creamer. Other than that, also have to limit dietary cholesterol from internal organ, seafood, and egg yolk. Minimize trans fat intake from fast food, hard margarine, and processed snack. For the sodium intake, aim for less than 2000 mg, which is 1 teaspoon of salt in a day. This I said all above is the way to control your diabetes. At the same time, to minimize other complications of diabetes like cardiovascular disease. Artificial sweetener are safe to use because it does not have impact on blood sugar level. Common artificial sweetener like aspartame, sucralose, stevia, and lohango extract. These are safe to use. However, you cannot take it excessively so that it will remain in the acceptable daily intake for the artificial sweetener. No, because artificial sweetener contains zero or low calorie compared to table sugar. However, when taking any product that contains artificial sweetener, like biscuit or chocolate. It also have energy, and carbohydrate, when you are taking it excessively, can cause weight gain. Carbohydrate is the big group which consists of simple carbohydrate and also complex carbohydrate. Simple carbohydrate, or we call it as simple sugar, is the sugar or any kind of sugar like brown sugar, gula melaka, or honey, or any high sugary food and beverages like kaya, jam, soft drink or packed drink. This simple sugar rapidly digests and cause rapid increase in your blood sugar level. Meanwhile, the complex carbohydrate like rice, bread or cereal product takes a longer time to digest and cause slower in increasing your blood sugar level. In addition to controlling your diabetes, do include complex carbohydrate in your daily diet, but within your requirement, mainly in the form of high fiber. These include whole grain, starchy vegetables, legumes and lentils. For example, you can choose brown rice or wholemeal bread instead of white rice or white bread.
The very lovely Nurata Amin there speaking to Dr. Lim Siang Chin, Dr. Yu Shiong, and Puan Salasiah binti Muhammad Puji. Of course, two of them are doctors and one is a dietitian. They talked, or rather expanded a lot on what diabetes mellitus is right here on Medical Today. Stay with us. We'll take a break and come back with more for you right here on Medical Today, only on BNC.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye, Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor.
Welcome back to the final segment of Medical Today, right here on BNC. Well, a little story for you just before we roll another video. Some time ago, I went for a performance, and in the midst of a performance, someone just went down like that, flat on her face. Apparently, she was having a seizure. So I ran to her aid, but I didn't know what to do medically. So the best thing I could do was to put her on her side. But that's the only thing I knew. But up until today, when someone has a seizure, we still keep putting things into their mouth. Apparently, it's a big no-no. Now, we have a video that we've played before. We're going to roll it for you just one more time, just so we're clear as to what we can do when someone has a seizure. Let's take a look at that video.
What? You want me to come today? Okay. Cannot lah. Tomorrow not possible. Okay, I got training. Okay, I have to run there. Not enough time. Okay, by the time I finish also quite late already.
Check. Okay, you are okay. Yeah, I'm with you. No worries, okay? No worries.
So there we have it, a little video for you with regards to seizure. We did have people call us and say, hey, that was a great video, so we decided to roll that again for you in this week's episode of Medical Today. Well, we're going to come back next week, but before that, let's just walk through some information. If you do have a question for us, send your question to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll get the doctors or the subject matter experts to give you the information you need with regards to your questions on medical conditions and medical doubts. We'll be more than happy to get people to answer it for you. In the meantime, don't forget, next week we're in episode 4. We have bariatric surgery. What's that all about? We're going to walk you through what bariatric surgery and weight management is. We'll be having Dr. Lim Hui Chian, a consultant general surgeon from Region Specialist Hospital from Johor, joining us here on Medical Today. On that note, I'm Jared Ratnam signing off. You have a fantastic day ahead, and join us on the next episode of Medical Today right here on BNC. Have a great day ahead.